Music as medicine is a concept that overlaps with music therapy and performing arts medicine. Hodges says music medicine is primarily physician-driven, but can also include music therapists and nurses. Patients involved in music medicine are typically those receiving surgery or who have pain. In my case, I often use noise-canceling headphones at the dentist to block out the intense perceived sounds of buzz saws or water hoses used to drill or shave off parts of my teeth. I also like to block conversations between doctors and nurses. Physicians and other healthcare professionals sometimes use music in medical clinical practices to promote healing following surgery and to reduce pain and anxiety. Headphones are a good way for medical providers to help patients block out sounds that are associated with pain. In 1973, research into the use of music in medical treatments provided the foundation for music medicine. This led to the formation of the International Society for Music Medicine. Dr. Spinke collected data on over 160,000 surgical and pain patients for whom drug doses were reduced to up to half. We currently know that musical pieces chosen by the patient are commonly, but not always, more effective than pieces chosen by another person. Examples of music medicine are music to control pain, reduce blood pressure, heart rate, or muscle tension. Music has been used in surgery, anesthesia, acute and chronic pain therapy, palliative and intensive care, obstetrics, pediatrics, geriatrics, gastroenterology, behavioral disorders, motor dysfunction, cancer care, ophthalmology, neurology, and much more. Project Music Heals Us is a nonprofit organization whose mission is to provide inspiration, education, and healing through live music performances and interactive programming. Amidst the pandemic since early April 2020, Music Heals Us has been offering its programming to COVID patients hospitalized across our country. Dr. Rachel Easterwood is a professionally trained musician turned physician who began the Vital Sounds Initiative in Music Heals Us. Easterwood began the project with piano playing via live stream to patients during the COVID pandemic, and this is a quote. This is a video from the Vital Sounds Initiative.
It's not silence on the other side of the call. It's a lot of noise. It's a lot of beeping from the machines. Typically, you can hear the ventilator breathing for the patient.
This is Yo-Yo Ma at age 7. Today, he has joined the Vital Sounds Initiative, which is part of Music Heals Us. Music Heals Us is providing over $80,000 in musician support for arts and service of patient rehabilitation, performing artists who have had their livelihoods threatened by the shutdown, and caregivers. More proof of music medicine can be found in these images from Hodges' online book supports. The image on the left shows levels of adrenal stress in pregnant women, one not listening to music, the red line, and one who is, the blue line. Music helped preserve natural body chemicals, meaning fewer sedatives were necessary. In the image on the right, a patient uses a visual analog scale to report on the level of perceived pain and anxiety prior to and following a spinal injection. Patients who listened to music, the green line, experienced a reduction in pain and anxiety during the waiting period compared to patients who did not hear music. I conducted a self-study of how music could help me during deep transcranial magnetic stimulation, DTMS, when I had my sessions, because I was so anxious just going to my first appointment that I almost left and never went back. I didn't know if I would suffer any side effects. Though DTMS is non-invasive, the most common side effects are temporary, mild pain or discomfort in the area of the treatment site. They usually manifest as headaches in about half of the patients. Other less frequent side effects may include muscle twitching and jaw pain. During my treatments, I decided to wear soft earplugs between my back teeth to help prevent jaw pain. I also used a chromatic tuning app to help calibrate tones that I was perceiving to hear, and then sang. The first sheet on the left reflects what I sang into the tuner, and the slashes are the chromatic sense written numerically on the next sheet during another session. In the latter part of my treatments, when I was sure that singing was helping relieve my pain and anxiety symptoms, I started to bring colored pencils and creative sheets. I did not have a plan, but just went to writing and coloring. When the treatments began, this sheet came first, and it continued through several treatments. Later, I was familiarized with meditation chakras, and I tried to notice where they might be resonating in my body. It seemed that zones in my body often lined up with my moods and perceived tones, at least at this time. I also looked for hertz frequencies, vowel sounds, and colors, and singing became my medicine. The flip side is music as torture, and declassified CIA reports revealed this song playing as a loop. And I'm going to leave you with one last positive video.
At my hospital, we're all a family, and I think that it actually helps not only the patients, but also the morale of the doctors and nurses. I hope that this music for patients brings them a sense of comfort that's definitely lacking.